Very good morning to you, Professor. Firstly, talk us through the sort of numbers that we're looking at in this country.
Yeah, good morning. TB, as you outlined, is far from eradicated, and it's a major problem in South Africa. We treat about somewhere between 300 and 350,000 cases of TB per annum. And just to give you some economies of scale, in the UK, with roughly a similar population, they have less than 10,000 cases. So we have a lot of TB cases. Roughly 5% of these cases have what we call multi-drug resistant TB, meaning that they are resistant to the two common first-line antibiotics that we use to treat TB. And I think you mentioned this as well, that TB is now the most common cause of death in the country, kills almost 60,000 people a year, it's a massive drain on the economy, and I can talk about that a little bit later. But onto the missing cases, it is extraordinary that about 2 in 5 TB cases globally, so this is not only a South African phenomenon, it's a global phenomenon, are missed or undiagnosed. And this amounts to somewhere between 100 and 150,000 cases in South Africa that are unreported or undiagnosed.
All right, why is the problem so bad here? What are we doing wrong?
Right, so as I said, this is a global phenomenon. It's not a situation unique to South Africa. And the problem, there are a number of problems with TB. Firstly, it's challenging to diagnose. People have symptoms of TB and they don't realize it's ascribable to TB.
Okay, tell us what the symptoms
are. They may
are.
not have access to health services or... Yeah, so the typical symptoms of TB are those of persistent cough, night sweats, fevers, sometimes coughing up of blood, chest pain, and so forth. And the key thing about this is that the current public health strategy, not only here in South Africa but globally, is one of passive case finding, where we wait for patients to self-declare their symptoms and come to clinics and hospitals. But in fact, many people are unaware of these symptoms or cannot access services for whatever reason. And so there's ongoing transmission from these cases in the community, because TB is spread through coughing. There's tiny droplets in the air that are breathed in that contain TB bugs. So this is the primary mode of spread. So as you can imagine, if these individuals are out in the community and they're not diagnosed, there's the ongoing spread of TB. And we're never going to get on top of the epidemic unless we find these undiagnosed or missing cases.
And there's a frightening link between HIV and TB, isn't there?
Correct. And one of the reasons why we have so much of TB in South Africa, about half the TB burden is ascribable to HIV. HIV, as you know, knocks out the immune system, and so those individuals are exquisitely sensitive to TB. It also makes TB a lot more difficult to diagnose. And so the challenge is, if you're going to find these missing cases, how do you find them? How do you go out into the community? And if you do find them, what kind of test do you use? Because many of these individuals are HIV infected, which makes TB a lot more difficult to diagnose.
You touched on it briefly. If you can elaborate more about the economic impact that it has.
Yeah, so although it's reasonably well documented, it's not well appreciated, and certainly we don't know for sure exactly how much TB costs the nation. There were estimates by KPMG, and I was privileged last year to be part of an economist intelligence unit that looked at this. And roughly it's somewhere between 2.5% and 3% of our GDP, because it disproportionately affects economically young, active individuals. So you're looking at somewhere a figure of about 150 billion rand, which is more than the actual government health budget, or more than half of what we spend on health expenditure in the country. So it's got a huge economic impact. And if you actually think about the current economic woes we have in the country and where we are, these kind of differences start becoming quite significant. And moving on to how to find these cases, lots of people have been looking at optimal ways to take diagnostic tests out into the community. At the University of Cape Town, we've been doing a lot of research on this, and we've developed a model using a scalable model using a Nissan panel van, where we put DNA-based diagnostics, portable diagnostic tests onto the panel van, and we go out into communities where there's a very high incidence of TB. And if we do targeted screening of certain types of individuals, the pickup rate is an extraordinary 10%. And we now have considerable funding from international funding agencies to trial this methodology in 4 different sub-Saharan African countries. And we are working, the Department of Health is supporting this project and is aware of this project. But this is just one example of how one needs to change tact, and instead of waiting for patients to access health services, to take diagnostic services out into the community and find TB cases.
All right, Professor, fascinating stuff. Thank you.